Hello, we are live. Welcome. Today's video is looking at birth control and fibroids, and this is particularly for anybody who's wondering if birth control, contraception, pills, coil implants, and so on can lead to fibroids developing or fibroids growing, and asking yourself the question, should you stop your birth control because you're worried about fibroids? It's not for everybody. This video is not for everybody, because I might get some comments here and there from people telling me we know birth control causes fibroids. I can't take away what you know, what you choose to know, but I want to have an objective look at this question. And for those who have an open mind and genuinely want to know what is available or what the research indicates about birth control and the relationship with fibroids, you're very much welcome. Sit down with me. Let's take the next few minutes to go through this question. You're all very welcome. My name is Dr. Sylvia. I'm a general practitioner and health educator with AskAwayHealth. I'm just popping on my mic. Just realized I didn't have the mic on. So guys, we have been talking about fibroids this whole month, and we're nearly at the end of July. But of course, we shall still continue talking about fibroids. Okay, so this question is important because a lot of people come on my channel and I do get a lot of interaction with people saying that birth control pills cause fibroids. So we're looking at particularly those containing estrogen, but there is also some concern about progesterone only birth control. And with the combined pill that contains both estrogen and progesterone, you have other birth control methods like the progesterone intrauterine system, which is the progesterone coil, or you could have the implant. These are progesterone only medicines or only birth control methods of contraception. So let's look at it. I'm going to share my screen in a moment with you and look at some of the studies. We're talking about fibroids, of course. Fibroids are benign growths of the womb muscle, extremely common. In fact, the most common women's tumor. They're benign though, which is why they do not cause, I think, as much an outcry as they would if they were cancerous, clearly. But despite that, they can still cause a lot of trouble, a lot of distressing symptoms, a lot of distress from fibroids. That said, though, and when we're talking about how common they are, it is thought that up to 80% of women might have fibroids in their lifetime. Okay, well, that said, many women who have fibroids do not have symptoms. So that's how complex fibroids can be, i.e., they can exist in a woman's womb and cause no symptoms, obviously, depending on their size and their number and their location. But in other women, they can exist and cause extreme problems. You know the drill: irregular bleeding, irregular menstrual bleeding, pelvic pain, painful sex, trouble passing urine, trouble opening your bowels, back pain, leg pain, and trouble with pregnancy in 1 to 3% of cases. So these are the issues around fibroids. But the question is the relationship between fibroids and birth control. Okay, now we have some idea about how fibroids or what causes fibroids to grow. And I've been very careful with that statement because we don't know what causes fibroids to develop. We still do not know. So anybody who is confidently telling you that birth control causes fibroids is already falling down on that leg, because we don't know. We know that there are several possible factors that are involved or indicated in the growth or development of a fibroid. We don't know how they mix in together to result in fibroids in one woman compared to another. So yes, it is true that there is a big hormone influence with fibroids. Yes, I will definitely agree that. But the fact is that you don't consistently see hormones causing fibroids in every single woman. So you cannot blame hormones alone for fibroids developing. And so that is the reason why I say to you that anybody telling you that birth control causes fibroids without any qualification is not telling you the facts. They're not saying the truth. So other things that we feel can be involved in fibroids developing, of course, your genes or family history, We know that there are issues around the type of food or your diet, for example, excessive quantities of red meat, processed foods, high sugar content foods, alcohol, caffeine have been mentioned in terms of being implicated in the growth and development of fibroids. We know that things like low vitamin D as well has been implicated. We know that being overweight, all these things have been implicated. But we can sit down and then we can argue about these possible causes. What about a woman who is not overweight, who is not obese, whose diet is very healthy, who doesn't eat red meat and who doesn't smoke and who doesn't take alcohol but still has fibroids? So I'm just trying to say to us that it's a complex situation. So if you're just joining, thank you so much. I'm doing a faceless video this evening because it's, why not? But I wanted to get this topic covered in this particular series that we've been doing for Fibroids Awareness Month, because I do get a lot of questions around it, and happy to take any comments or questions on this topic if you want to drop a line. But thank you so much for clicking on. Right, so let's get into this, right? So what are the things that make people think that hormonal birth control causes fibroids? So like I've said, it is true that hormones are implicated in one way or the other that we don't fully understand in the growth of fibroids. That is true. And of course, these birth control methods that contain human-made hormones, estrogen and progesterone, they can affect growth and development in the womb tissue, and contribute to the growth of the fibroids. So we know that estrogen promotes the growth of fibroids. Now, and think about the way the birth control works. Remember that when a woman starts taking birth control, these external hormones in the birth control method sort of switch off your internal hormones. So for a little while, or for the period while you're taking the birth control method, your own body's natural hormones sort of go to sleep. And so your tissues are under the influence of the external hormones, okay? That is why for a woman who has very heavy periods, for example, she may not have fibroids, but she may just have very heavy periods. If she starts taking the birth control pill, the combined birth control pill, after a while, because her own natural hormones are switched off and she's receiving a controlled amounts of the hormones, she ends up with thinner bleeding or thinner periods, or less heavy periods, what I'm trying to say. And that's the effect of the hormones in the pill that she's taking. Okay, so because her own natural hormones have been switched off. So we acknowledge that one of the reasons why we could suspect that birth control could cause fibroid is related to estrogen, one of the hormones in birth control, which is estrogen, that we know can promote the growth of fibroids. Progesterone can also have an impact, because progesterone is a hormone that works on the womb lining. Fibroids are tumors of the womb muscle. So there can be some relationship. So I'm not letting either of those two hormones off scot-free. I agree that there could be some implication, but what I'm against is the blanket statement that birth control causes fibroids. The other thing is that if you use birth control methods for a long time, and when I say long time, so as you grow, perhaps from teenage years into early adulthood or into your mid-20s or 30s, the fact that you're using the birth control methods and growing into those older years, potentially the risk of fibroids increases as you grow older. We know that fibroids tend to be more common in women in their reproductive years, so 20s, 30s onwards. So it could be that we're looking at two things going on. That is, one, this lady was probably going to develop fibroids as she grew older, and it's not necessarily as a result of the birth control. Or it's the fact that there's something going on, some other factor, plus the fact that she was probably going to develop fibroids, plus the fact that she is growing old and she's on the birth control method. So these are possibilities, possible reasons why there might be some association. So I've talked about, at the beginning, we talked about how there are different factors that might explain how fibroids happen. We don't know them fully. We just know that in a particular woman, there is a mix of different things, and it may be different from one girl to the other. Some women may just be some reason have a genetic predisposition or something else that makes them more susceptible to fibroids. And maybe if it is that type of woman who is more susceptible, then it may be that taking the birth control and the hormones in the birth control increases that risk of developing the fibroids. Now, I want to share, so those are some of the supporting factors. If you're just joining, hi, this is a controversial subject, I know, but I really want to get it out there because I want people to think about the statement and think about their options. And like I said at the beginning, this video is, if you're wondering if birth control can lead to fibroids, what is the truth? If you're wondering whether you should stop your birth control method, please watch this, have a think about it, speak to your doctor before you take a decision. There's nothing political about this. I'm not being sponsored by any pharmaceutical company. I'm just speaking based on the research that we have available. And I will say here that we don't have enough research on the subject. Let us all agree on that, at least, that we need a lot more research to tell us which way, what is the right thing. So let me share my screen for you or with you. And it's just a study that I've come across, and I think it's an interesting study. So it's comprehensive review of fibroids. Give me a second, guys. So hopefully, yes, okay. So let me go right to the top of this paper so that you see the name of the paper. It is a bit of a technical read and it is a bit lengthy, but it is worthwhile for somebody who is interested in the subject. So this was published in 2021. So thankfully, it's fairly recent. It's called the Comprehensive Review of Uterine Fibroids, looking at the origin of fibroids, the pathogenesis, that is how fibroids develop, how they grow. So one of the things I love about this paper was they looked at different cause scenario. What's the word I'm looking for? They looked at the different possible causes and tried to address, without trying to make any judgment in either for or against. They just looked at, right, what is it about diet? What is it about alcohol? What is it about weight, and so on? So that was how they looked at the possible issues around fibroids and treatment. And this was a paper, I think it's a US study. Let me see if I can find. I think it's a US paper, if I remember correctly. These authors, I think they're working in I don't know which hospital in the US. You can always look that up if you're interested, but it is a US paper. So I want to just take you down to the bit that talks about, so this is going to surprise you, I know. So like I said, you can see different issues. They talk about high blood pressure. They talk about vitamin D deficiency. They talk about pregnancy. So that's a woman who's never had a child, and the finding that women who've never had children are more likely to develop fibroids. So that's looked at in this study as well. Okay, then of course they looked at obesity. They looked at race. They looked at age. Okay, so these are some of the causative factors around fibroids. They had a look at each of them. So I'm going to this bit here, protective factors, and let's read together. The use of oral and injectable contraceptives can reduce the risk of developing uterine fibroids. What? Who's saying that? How is that possible? That is so contrary to what is out there. That is so contrary to what people believe. And not everybody, let's be fair, but there are some people who have had really horrendous experience with fibroids and of course want to know why. And one of the things that's easy to pick up on is the birth control method. And I'm not here saying that the birth control does not have a role. I'm just trying to say to us, let's have an open mind, and that we don't know all the things behind the cause of fibroids. But according to this paper that looked at several other studies, so it wasn't just their own work, they were also looking at reports from other clinicians, other scientists. So the first thing they're saying here is that the use of both the oral, that's the tablet pills, and the injection contraceptive, like the depot is what this is referring to, the depot shot, can reduce the risk of developing womb fibroids. You don't hear that a lot. Here is what they go on further to say, that hormonal contraception protected women from developing clinical symptoms of fibroids. Now, you would need to look at this study in better detail. How many women did they find this in? What was the characteristic of these women? What else can you generalize this statement? I'm not saying that this is a hard and fast rule. I'm just saying that in this particular study, these were the observations. And you can get that a lot when you're doing research. You may find that so a group of researchers are studying a particular question, and they come up with some theories, or they come up with some hypotheses, and their study gives them some results. A couple of years down the line, you might have similar scientists doing studies on the same question, but they may have a different group of women and they end up with different results. So we need to bear all this in mind. But according to this, they had a study that indicated that this hormone birth control protected women from developing clinical symptoms of fibroids. Now, listen, however, using oral contraceptive, that's the birth control pill, at adolescence, which is really important here because we're talking about our teen girls. We're talking about our girls from 11, 12, when they start their period. Some of them for the first year of their menarche, that is when they first start their periods, can have very irregular, heavy bleeding because the pattern hasn't been established yet. We should know that many girls do experience periods that are up and down all over the place for the first year or so, and then in many women it will settle down, but for some girls it doesn't, and they have a horrendous time. I personally am not happy with just sticking a girl on birth control method when she comes in with irregular heavy bleeding and leaving her long term. If it has to be used just to help her gain some control for a short period of time, bring her back, maybe for a few months, a few weeks to months, a couple of months, bring her back and have a sit down with the girl and work out what is going on. How are the periods? Has the pattern changed? Has it improved? Is it worse? I do not believe in just sticking somebody on birth control pills from age 13, for example, and then just leaving her to go off on them. But I digress. But this is saying, however, using oral contraceptives at adolescence may be considered a risk factor for developing symptomatic uterine fibroids later in life, whereas using them after adolescence reduces the risk. So let me just break this down, okay? If you give the birth control pill to a young girl in her adolescence, so we're saying between the age of 13, 14, 15, and so on, she may go on to develop fibroids later in life, okay? However, if you give the birth control pill to a woman 19, 20, that is after her adolescence, it reduces the risk of her developing fibroids. That is what this statement here is saying. That is what this statement here is saying. That is this finding here, okay? It goes on to say contraceptives increase estrogen and progesterone concentration in the body, indicating that mechanisms other than hormonal levels are involved in the development of fibroids. So that's the point. That is the point I'm trying to get at. That is the explanation I have for people who say, oh, it's fibroids that's causing it. Sorry, it's the birth control that's causing the fibroids. That's the understanding that I want women to have, that fibroids is a lot more complex than that. I have every sympathy for a woman. I come across horrendous stories. It is horrible. And if you go through all the videos that we've been doing for the past 3.5 weeks, we particularly emphasize the emotional impact, the mental health impact of fibroids, not just the physical symptoms. So I'm completely sympathetic to people who have fibroids and are struggling with it. But I also would like an open mind in terms of the cause, and not just in terms of that, is also the messaging around using birth control. I'm not a proponent by any means of birth control in one way or the other. I am a proponent of safe medication use and understanding why you're using a medicine, understanding your body and the potential impact that it could have on your body. So this is not me saying that you must go out and use birth control. No, that's not the point of my videos. I actually teach about how it could affect your body, how to recognize possible side effects, how to deal with them, how to decide whether or not birth control, hormonal or non-hormonal, suits you, and so on. But that is not the point of our discussion. The point of our discussion is, if somebody is out there wondering whether she should take birth control because her friend told her that it causes fibroids, then I want you to look at this video and think, okay? Because there are women who have taken birth control and did not develop fibroids. So how do you explain those ones? Okay, so the thing is that the evidence is very inconclusive. So that's why I said at the beginning that anybody who's saying that to you is not being very complete with the facts, because we don't know. We just don't know enough to make that blanket statement. We still need a lot more research. Okay, fibroids could potentially be as a result of other things like your genes. I've talked about them already: diet, weight, and so on and so forth. The other reason is, what about birth control being used to treat fibroids? What about that? What about that? How is it possible? Why does it happen that for some women, some, not everyone, some women with heavy irregular bleeding from their fibroids, one of the first things, or one of the first conservative, we call those conservative because they're not surgical, they're medication, so nobody's using not cutting anything, so that's what conservative means. So it is drug treatment, medicine treatment. So one of the drug treatments that we have for women with fibroids suffering from very irregular, very heavy bleeding is using birth control to control the bleeding. And mind you, we have different types. So we have hormonal drugs or non-hormonal drugs to treat heavy bleeding, heavy periods, painful periods, and so on in fibroids. And I can't remember which video, maybe in the first week of this month, if you go and have a look, you will see the video where I talk about fibroid treatment. But we have the non-hormonal and we have the hormonal ones. Non-hormonal ones, for example, ibuprofen, naproxen, which are drugs that can help to manage painful periods and help a little bit to reduce blood flow, maybe make bleeding a little bit less heavy. Then you have things like tranexamic acid, which is non-hormonal. Then on the other hand, you have the hormonal options. So things like the pill, things like the progesterone coil that goes in the womb. Women are given these methods to help to control their bleeding from fibroids. And in some women, it helps. So that doesn't really add up then. It doesn't really add up to that argument that you're giving, saying that birth control causes fibroids. So there is that. And for some of these women, using these methods actually helps them. It helps to regulate their cycles, apart from controlling their bleeding, helps to control their cycles. It's regular. It calms down the bleeding so they're not at risk of getting anemic, which is a big issue that many women with very troublesome, significant fibroids can have. Okay, so, and again, please, I've said it, I'm not saying this is a standard quid pro quo for every single woman. There are some women who do not benefit from using these hormonal methods, birth control, for treating their fibroids, but some do. So you can't explain. We're still in a situation where we haven't got an explanation. We're sort of in a maze. We're still scratching our heads a little bit. And I know it sounds as if we're dealing with people's lives. How are we scratching our heads? But this is what it is, that we still need a lot more studies. We still need a lot more research to guide us as to perhaps birth control is not the answer in this particular woman, and why. We don't know that yet. But because we know that it can help some women, when somebody comes who's having troublesome bleeding with fibroids, it will be offered to her. And of course, every woman has the right to say, no, I don't want hormones. That's perfectly fine. That's perfectly fine. But I'm just saying that if your mind is open enough to look at the question, it is worthwhile thinking about it. Also, fibroids do develop in women who've never used birth control. So that again emphasizes the fact that there's something else, or there are other factors involved in the development of fibroids. Now, one other question is about, okay, for women who use fibroids, and this is common for women who have fibroids, and then we treat them with the progesterone system. The fibroid seems to get better. There are some women who do have that experience. The progestin, which is the man-made version, the human-made version, seems to protect from the fibroid. So those women might notice that their fibroids actually shrink. Let me drop another interesting nugget in it, because I came across a paper. I might do a separate video on this if I've got the time, where the scientists looking at this study said, before, we used to think that we knew how fibroids grow. We used to think that you can plot the way a fibroid behaves on a graph, and it's linear. What that means is that over time, you can predict how the fibroid will behave. Now they know, scientists know. I mean, women could have told them that years ago, I'm sure, but it is not linear. It is not predictable. So some fibroids can grow to a point and then for some reason they start shrinking. Yes, that can happen. It can, for reasons that are not clear. It may not have anything to do with birth control. It may not even have anything to do with particular changes in diet. It may just be that the fibroid is, for some reason, its growth trajectory, its growth pattern or phase just went in that direction. It developed, grew for some time, and then started shrinking. There is no timeline to it. Some fibroids can do that, spontaneously regress. That's what that's called. They spontaneously regress. And again, I'm saying it's not just after some birth control, but we have noticed that it can happen in women using some birth control methods like the pill, or like the combined pill, or the progesterone system, that is the progesterone coil. So what we're saying is that if the hormonal birth control is actually a cause of the fibroids, you would expect that when you stopped it, okay, the fibroid, when you stop using the hormonal birth control for some women, the fibroid should stop. If it was what caused it, if you stop it, it should stop, shouldn't it? But that doesn't always happen. So this is why I said that it's as if we're in a maze. It's as if there's still so much that we're not sure about, that we don't understand. It's still so much that we're not very clear about. And like I said, this particular video is for people who are asking those questions. What is the situation with fibroids and birth control? Am I safe using this birth control method? The thing is, we can't tell you. If already you have some of those other risk factors, for example, you're overweight, you're smoking, you're using excessive amounts of red meat, you take alcohol, coffee, what else? Low vitamin D. If you have a family history of fibroids, then I might say to you, I would watch my choices in terms of birth control. It might be that you'll be better off with something that's non-hormonal. That is a reasonable way to think about it, given the information that we have in front of us. If, on the other hand, you don't have any of these risk factors, I'm not going to push you to use any birth control method, but I would encourage you to sort of have this rational thinking behind it and not just get carried away by people who say birth control, estrogen and progesterone cause fibroids, because they haven't got the evidence to make that blanket statement. So I would encourage you to think about it, to consider that point, or these points that I've demonstrated in this in this video. It's sometimes I don't have the opportunity to sit down with my patients and go up and sort of put these arguments back and forth, but I think it would be really useful and helpful for people to know, and that will help them to make the decision that they need to make. Right, thank you. I have got a couple of people lurking in the on the stream somewhere. I hope this has been useful to you. If you didn't have any questions or comments, that's fine. But if you're watching on the replay and you've got a comment, it would be lovely to hear from you. And of course, you can always send me a question via the email health information service. Let me show you, before I let you go, let me show you what we've been doing all this month for fibroids awareness, because I'm really happy and proud of what we've been able to cover. And if you're somebody who, it's on a playlist actually, if you're somebody who has wanted a place where you can just sit, oh, hang on, let's not make too much noise. I think this is the best way I can show it. So let me share my screen. So if you're somebody who's been very interested in fibroid information, who wants to come to a stream or come to a place where you can get lots of informative videos about fibroids, then this is the place to be. So let me share my screen. So the bit I'm interested in is this bit to the left. Ignore these two chaps. I don't know what they're talking about. But over here to the right-hand side, these are the different videos that we've got. Fibroids causes and prevention. Fibroids Awareness Month, recognizing symptoms. Yes, this is the one I was talking about. Best option for fibroids treatment, medication, non-medication. This is just an overview. So it's not very long. It just gives you a nice overview of what's available, so you don't feel pressured into any one thing. This is what's available. Then we talk about myomectomy versus hysterectomy. We talk about the emotional challenges living with fibroids, so natural fibroid remedies, yoga, healthy lifestyle, stop heavy bleeding, surgery alternatives to fibroids. So talking about the MRG, FUS methods, and uterine fibroid embolization, lifestyle changes that can help to manage and stop heavy bleeding, a comprehensive look at dealing the different options we have for treating fibroid bleeding. I went into detail in this particular video. Then I have a couple of videos where I talk with my colleague who's a gynecologist. We look at fibroid questions. We answer them on this particular video. It's about an hour long, but it is well worth your time just sitting down, let this play, and you might find something that's really of value to you. We looked at preserving your fertility if you have fibroids. We looked again at dealing with the emotional impact from fibroids. We talked about myomectomy, the different types, and which is right for your type of fibroid. We looked at fertility, your sex life, fibroids, mental health. Guys, there is so much here. There is so much. I'm really glad that we're able to cover as much as we have done so far for Fibroids Awareness Month. Okay, so we're going to cut it short here. Thank you so much for watching and for listening. I hope you find this useful. Please give this video a like and, of course, subscribe to the channel. Thank you so much for your time, guys. I will see you again soon. Bye-bye.